nasal part related to the lid. Aid in elevation.
دكتورة فريال حضرتك شفتي دكتورة هدى مشيت؟
مشت elevation and depression of the lid. The third part around the lacrimal sac, the main or action of this part is to close or to dilate.
Close.
No,
To
to dilate. This is the active part. When the palpebral, the lacrimal part contract, it leads to dilatation of the sac. Therefore, the tears can be collected. شكرا يا دكتور. The tears can be collected into the sac. When this part relaxes, it closes the sac. This is the active part, dilatation of the sac.
Dilatation of the lacrimal sac.
So the tears collected. Relaxation of this part leads to closure of the sac. Okay? The second is orbicularis oris. To the reverse of this muscle, this is not an actual muscle by its own. It is formed by grouping of all the muscles comes to the mouth opening. Main part is the vaccinator. And then, in addition to vaccinator, levator labii, depressor labii, levator anguli, depressor anguli. All these muscle fibers together with the fibers of vaccinator are grouped together to form what is called the orbicularis oris. If we take the vaccinator on the side here, related to angle of mouth, the fibers of vaccinator passes horizontally like this. They are divided in three groups: upper, middle, and lower one. The upper goes to upper lip to form the substance of upper lip. The lower goes to lower lip. The middle one decussate. The lower fiber goes to upper lip, and the upper fiber goes to lower lip. All these fibers, muscle fiber, constitute what we call orbicularis oris. Okay. This vaccinator is considered as one of the muscles of expression.
Again, about the muscle fiber?
Yeah. Muscles of the face are called muscles of expression. The vaccinator is also one of the muscles of the face, but it has other action. It is used during mastication, but it is not a pure muscle of mastication. The muscle of mastication are masseter, temporalis, medial pterygoid, and the lateral pterygoid, together with the vaccinator. These muscles of mastication are supplied by mandibular division of trigeminus. The vaccinator is supplied by face. That is why it is one of the muscles of the face. But it is used during mastication. Okay? This is the around the nasal orifices, small muscles. Levator labii superioris aliti nasalis muscle. These are small muscles related to the nasal orifices and side bones. So the main are ocularis oculi, ocularis oris. Vaccinator is a main muscle in the face. There are other muscles, zygomaticus major, zygomaticus minor. You have to know them by names. The motor nerve of the face is facial. The sensory nerve of the face, trigeminal, by its three subdivisions: ophthalmic, maxillary, and mandibular. In addition to the three divisions of trigeminal, the face is supplied by cervical nerves, second and third.
Second and third.
Yes. Represented by a nerve which is called greater auricular nerve. Greater auricular.
Oh, greater oculus.
Greater auricular. It passes like this. It encircles the lobule. Branches in front, branches behind.
It represents the cervical plexus.
Yeah, it comes from the second and third cervical nerve. It supplies the skin over the parotid gland. It supplies the skin over the angle of the nerve. So the angle of the mandible is supplied by cervical nerves. The rest is supplied by branches of trigeminal. This is sensory. So motor, facial, sensory, trigeminal, plus cervical nerve, second and third. In relation to arterial supply of the face, there are superficial arteries and deep arteries. Superficial arteries are facial artery, branch of external carotid artery. A branch here on the cheek which is called transverse cervical artery, a branch of maxillary. On the temple, this region, branches are superficial temporal artery. Deep arteries of the face are branches of maxillary artery. That is. So these arteries anastomose with each other to form a rich blood supply to the face. Rich blood supply. The arteries are drained by veins. The veins are anterofacial and posteriorfacial. There are two structures here. The tortuous one is the artery, the straight one is the vein. The tortuous is the artery, which comes from this one. This is tortuous. This is branches of facial artery. The straight one is the vein, the anterior facial vein. The posterior facial veins comes from the lower border of the parotid gland. Yeah, because it is formed deep to the parotid gland by maxillary vein and superficial temporal vein. This is the origin of posterior fascia, deep to the parotid gland. Okay? Then the vein passes to come here at the lower border of the gland at the retromandibular or posterior facial vein. This vein divides into two divisions. Anterior division that unites with the anterior facial to form common facial. The common facial drains into internal jugular vein. The posterior division of retromandibular with the posterior auricular form the external jugular. The external jugular ends into subclavian vein. Subclavian vein. So this is the facial muscles, arterial supply, and venous drainage of the face. The face now.
This is the vein.
Artery is tortuous. This is the artery. Vein is straight. This is the vein. The artery is a branch of external carotid. Right? What is this muscle?
Platysma.
Platysma muscle. It is supplied by a branch of fascia. So it is considered as muscle of the face. Okay. We mentioned that in addition to facial expression muscle, there are other muscles on the face. These are masseter, temporalis muscle. The glands on the face. What is the motor nerve of the parotid? Glossopharyngeal nerve. Lesser superficial branch of glossopharyngeal. What I mean by motor to the glands?
Secretion.
Secrete motor fluid. Yes. We can go to the neck. The neck is can be divided into two triangles by median plane, lower border of mandible, and the most important landmark of the neck, which is this one muscle.
Mastoid.
Yes, sternum muscle. So median plane, lower